Bariatric surgery. You probably think it's an extreme solution for people who end up on TV shows like My 600-Pound Life, right? Did you know the typical bariatric surgery patient is a woman between the ages of 35 and 50 and is about 100 pounds overweight? Not extreme at all. Take Sarah, for example. She's a 45-year-old wife and mom of 3 kids. She's 5'5" and weighs 245 pounds. That means her body mass index, or BMI, is 41. That's too high. In fact, anyone with a BMI over 30 has the disease of obesity. Sarah's parents were heavy, and she has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. Oh, by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a pretty healthy diet, but her weight is now out of control. Sarah wants to be slimmer, but like most Americans, she thinks it's a willpower problem. She has always quietly fought this battle on her own, but is now at her wit's end. The straw that broke the camel's back was when she was too big to get on the roller coaster last summer with her kids. What Sarah doesn't know is that in addition to the frustration she feels about her weight, obesity has put her on a path towards heart disease, type 2 diabetes, and many other life-threatening chronic diseases. Most people think of obesity as a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for other chronic diseases, though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors, and left untreated, it's deadly. Sarah doesn't want to drag her feet until she develops diabetes, has a stroke or heart attack, or worse. So she takes action and asks her doctor to help her find effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah's bariatric surgery team talks to her about 2 options: sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her surgeon, Sarah chooses to have a sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions, takes about an hour to complete, and she spends 1 night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. There is safe and effective treatment for obesity, and it's not extreme.